Do you find penetrative sex really painful? If so, you may be suffering from a condition known as vaginismus. In this video, I'll be talking to you about the treatment steps that you can follow to overcome vaginismus so that you can enjoy pain-free sexual intercourse with your husband. If you're interested in videos about sex education and body positivity, I'd love for you to subscribe and hit the bell icon so that you're notified each time I upload a new video. The treatment steps that I'll be sharing in this video are the exact steps that I personally followed to overcome my own vaginismus, and they are the exact steps that I share with my customers and my clients to help them overcome vaginismus and achieve pain-free sex with their husbands. So let's start off by talking about what vaginismus actually is. Vaginismus is a condition in which the pelvic floor muscles that surround the vagina start to contract in an automatic, subconscious way. When these pelvic floor muscles contract, it causes the vagina to become very narrow, and this is what causes the difficulty and the pain experienced when a woman is trying to insert any object into her vagina. It might be when she's trying to insert a tampon, or trying to have penetrative sex with her husband, or trying to go for a cervical smear test. Any object that is trying to penetrate the vagina, if it's very difficult and very painful, indicates that you may be suffering from vaginismus. Now, it's really important to rule out any physical abnormalities or any medical conditions associated with your pelvic organs. So I highly recommend going to see your doctor to rule that out before diagnosing yourself or getting a diagnosis of vaginismus. When some women experience painful sex, or if they experience painful vaginal penetration with any object, sometimes they have a fear or they have a belief that their vagina must be too small, and that's not true. So the first step to overcoming vaginismus and achieving pain-free sex is to spend some time doing some mental and emotional healing. Now, it doesn't need to take a very long time to do this. It's simply a process where you ask yourself, what is the root cause of your vaginismus? Asking yourself, perhaps, why do you have a fear of sex? If you have a fear of sex, why might you be experiencing painful sex? And I just explained, if you've ruled out any medical conditions or any physical abnormalities, and it's simply due to your pelvic floor muscles contracting, ask yourself, why do you think your pelvic floor muscles are contracting? And typically the reasons are a fear of pain. It could be a fear of childbirth. It could be a fear of infection. It could be a fear of shame. It could be a fear for many different reasons, but it's typically due to some kind of fear. It could also be due to feelings of stress. It could be feeling anxiety. So typically those fear-based emotions that we have tend to cause a woman to have vaginismus. So the first step to overcoming vaginismus is spending some time, like I said, it doesn't need to take a very long time, spending some time asking yourself the mental and emotional reasons that are causing your vaginismus and seeing what steps you can take to mentally and emotionally heal. The next step that is really important is getting comfortable with looking at yourself down there, meaning understanding the different parts of your female sexual anatomy. One way that you can do this is actually to just go online, type onto Google, female sexual anatomy, label diagram, or label diagram of the vulva. And so the vulva, I'm just going to show you with this anatomical model here. The vulva is any part of your genitals that you can see externally. So if you look at yourself down there, that part of your female sexual anatomy is actually known as your vulva, and you may need to use a mirror. Most women need to use a mirror to be able to see it fully, properly. I'd say probably all women, unless you can really bend that sort of way. But really you need to use a mirror and use a diagram, a labeled diagram of your female sexual anatomy to know the different parts of your vulva. So know where your clitoral hood is, where the clitoris is, where your urethra is, your vagina, where the vaginal lips are. They're known as the labia minora and the labia majora. So knowing the different parts of your female sexual anatomy is very important. And once you know the different parts, pay attention to where your vagina actually is. And when I say vagina, I actually mean the entrance of your vagina or the opening of your vagina, because most of your vagina is located inside your body, so you can't see it. But the bit that we can see is the opening. So I'll just point it out here. The bit that I'm covering now with my finger is the vagina, okay, or the opening of the vagina. And that's really important to know where it is and become comfortable with using a finger or a couple of fingers if necessary, just to touch the opening of your vagina or the entrance of your vagina, because you need to know what it feels like and where it is in your body or on your body, so that you know where to position any objects that you are going to insert, whether it be inserting things like dilators, which I'll talk about later, or whether it be knowing how to position your husband's penis, especially if you're going to be having sex for the first time. A lot of women don't actually know where the entrance of their vagina is. So this is a really important step to be doing. The next really important step is to identify where your pelvic floor muscles are in your body and what they feel like, especially what they feel like when they are contracted and when they are relaxed. Now, in order to do this is the technique that I recommend that you follow. The first thing you need to do is to spread your legs fairly apart, so spread your thighs quite wide apart, and imagine that you are desperate for the toilet, you're desperate to pass urine, and your bladder is full of urine and you really, really need to go to the toilet, but there's no toilet around. And in order to stop yourself from passing urine because there's no toilet around, what you would probably be doing is be contracting your pelvic floor muscles. So imagine it now that you're about to pass urine, but you can't, like it's about to start trickling out, but you're not on a toilet yet. So what you would do is you would start squeezing and contracting your pelvic floor muscles. And to know whether you're doing this correctly, what you will feel is you will feel your muscles very subtly shift upwards in your body. It's very subtle, okay? But they go upwards slightly in your body and it feels like they are coming closer together. In order to get your pelvic floor muscles to be relaxed, what you simply do is you let go of that contraction. So you let go, allow those muscles to fully relax, and you will feel that those muscles very subtly shift downwards in your body, and it feels like the muscles are moving further apart. So you can squeeze your pelvic floor muscles to stop the flow of urine, like you're just imagining this. Squeeze your pelvic floor muscles together and feel that they subtly shift upwards in your body, and then let go of that contraction, let the muscles shift downwards in your body and move further apart. Okay, so this technique that I've described to you is known as a reverse Kegel exercise. Sometimes it's known as a reverse Kegel exercise, depending on how you pronounce it. Some people say Kegels, some people say Kegels. You may have heard of the Kegels or Kegels before. A Kegel or a Kegel is essentially the opposite, where it's not the opposite. It's the opposite of a reverse Kegel, but a Kegel or a Kegel is essentially where you are focusing on contracting your pelvic floor muscles to strengthen your pelvic floor. Whereas if someone has vaginismus, we want to do the reverse. We want to do the opposite. We want to practice relaxing our pelvic floor muscles so that our vagina is nice and wide and open. So this is a technique that you're going to need to practice a few times to get the hang of it. But once you've identified where your pelvic floor muscles are and what they feel like, you can do it like second nature. You can get them to contract and you can get them to relax, and you can do it in any manner. You can do it sitting down, lying down, standing up, and you can practice in different positions as well. So that's the step that you need to follow before you move on to the other steps in this video, is to practice your reverse Kegel exercises, practice how to relax your pelvic floor muscles. So what I wanted to do with you now is share with you an anatomical model of the female pelvis. And the reason I want to do this is to point out some of the parts that you are able to see when you look at yourself down there using a mirror to help you. So what we've got here at the very top is we've got the clitoris and we've got the clitoral hood. Now, something important to know about the clitoris is the part that you see is just the beginning of the clitoris. It's not the whole clitoris that you're actually seeing. So actually the clitoris extends more deeply inside your body, inwards, internally in your body, and you're not able to see it because it's actually inside your body. But the part that you can see is like the very beginning of the clitoris as well as the clitoral hood. Underneath that, the next opening that we have, this small opening here that I'm covering with my finger, that small opening is known as the urethra, and this is where we pass urine from. Underneath that, the larger opening that I'm putting my finger on now, that larger opening is the opening of your vagina. It's the entrance of your vagina. So as I mentioned, it is the entrance or the opening, and then the rest of your vagina extends inwards in your body that you can't really see. And what I do want to point out, which is really important, is the kind of red area. So if you look on here, all the red area are the pelvic floor organs, not the pelvic floor organs, the pelvic floor muscles. And this is really important because, as I was mentioning, it's these muscles that we're going to practice learning learning how to get them to be relaxed, because when they are contracted, they actually kind of close off, sorry, wrong finger. They actually kind of close off your vagina, making your vagina narrow. And that's what causes penetration with any object to be difficult or impossible and really painful. So once we get these red muscles to be relaxed, the pelvic floor muscles to be relaxed, the vagina is nice and wide and open, and therefore penetration is easier, smoother, and more comfortable and pain-free. So what I want to do now is I actually want to show it to you as a kind of cross section so that you can kind of see what's happening a bit more closely in your body. So what I'm going to do is I'm going to kind of pull this bit apart and share with you that down here we've got the opening. If you can look at where my finger is, we've got the opening of your vagina, the entrance of your vagina, and then we've got the rest of the vagina extending inwards in your body. And if you look really carefully around it, you can see that kind of more darker red area. That is your pelvic floor muscle. So when those pelvic floor muscles are contracting, they squeeze your vagina and the vaginal kind of canal, squeeze your vaginal canal to become more narrow. When the red area, those pelvic floor muscles are relaxed, they cause your vagina to be nice and wide and open, and therefore penetration is a lot more easy. Now, I have a few more steps that I want to share with you, but just before I continue sharing those steps with you, I'd love it if you could hit the like button if you haven't already, just to let me know if you've learned something new or if you're finding this video beneficial so far. Thank you. Okay, so the next step that is really important, once you've looked at yourself, you've looked at your vulva, you've identified the different parts of your vulva, you've identified where the opening of your vagina is, you know where your pelvic floor muscles are, how they feel like when they're contracted and when they're relaxed, and then you've spent time doing the reverse Kegels or the reverse Kegel exercises where you continually practice to relax your pelvic floor muscles. Once you've done that, the next important step is to gradually practice insertion exercises. So you will be inserting objects into your vagina. So as I was mentioning, that opening there into your vagina, and you're going to do this in a gradual way. Now, I know for many women who are experiencing painful sex or painful penetration with any object, that this can produce feelings of fear or anxiety or stress. And this is really normal, but typically the fear and anxiety and stress comes from a fear of pain. Now, I've taught you through the process of practicing reverse Kegel exercises, I've taught you that once your pelvic floor muscles are relaxed, your vagina is nice and wide and open, and therefore when you do insert an object into your vagina in that state, it's going to be easy, it's going to be comfortable, and it's going to be pain-free. And this does come from practice, and the very first time you may want to go through a process known as desensitization, where you just become relaxed and comfortable, simply touching the entrance of your vagina and not putting anything in, and then slowly, gradually working your way up through different sizes of objects, as long as the objects are safe and clean and not dangerous to use in any way. Now, some women like to start with fairly small objects like a cotton bud or a Q-tip. This one is a kind of more medical one, so it's got a slightly longer handle. You can purchase these yourself just to insert something really, really thin into their vagina to start with, and you may wish to add some lubricant to it. So you could use a water-based lubricant. The one I've got here is KY jelly. Some people don't like KY jelly. They find that it dries out too quickly. So do your research and find a water-based lubricant that is suitable for sensitive skin. I would recommend something like that, or something that uses more natural ingredients. You can actually also use something that is natural, such as coconut oil. The only time that coconut oil is not recommended is if you're going to be using it when having penetrative sex and using a condom at the same time. So you can't use coconut oil with something like a condom, but you can use it in other situations. So putting some form of lubricant onto the object of your choice and just placing it at the entrance of your vagina. So if I show you with my model here, I've got the entrance of my vagina. So if I show you with my model here, I've got the entrance of my vagina, and I would just place the object right there at the entrance of the vagina and not try and push it in, and just become comfortable, taking in some deep breaths and relaxing as I keep it there. And then once I'm able to relax my pelvic floor muscles, I can then take a deep breath in as I relax my pelvic floor muscles and slowly, gradually insert the object in at a pace that feels comfortable to you. Once you're comfortable with some of the smaller objects, you can gradually work your way through to slightly larger objects. So some women might like to insert something like a tampon. Other women like to buy a set of dilators or vaginal dilators. They're also sometimes known as vaginal trainers. So typically most women will call them dilators, and these come in different sizes, and I'm just going to share them with you here. The set that I have are made out of plastic. They are safe to use. They are medical tools to help you with practicing these reverse Kegel exercises. So you can see the small one is fairly thin and short, and then they get progressively wider and progressively longer too. So those were the first two sizes, and then the next two sizes. And then in my set, it comes as a set of 6, and then the final 2 sizes. Different dilators come in different sizes, but also in different amounts. So some sets might come as a set of 4, perfectly fine. Some might come as a set of 5 or 6, like mine does, or some even come as a set of 8. Typically, the set of 8, for example, will be a lot more progressive, whereas the smaller sets might have a slightly larger jump between the sizes and between the lengths. It doesn't typically really matter which set of dilators you get. You can experiment with different types and different brands, but overall the process is the same as long as you know how to relax your pelvic floor muscles and you use some form of lubricant to help you and you practice your breathing technique. On the note of breathing technique, what's really important is that when you are relaxing your pelvic floor muscles, it's really important to take a deep breath in, to do a big inhalation as you relax your pelvic floor muscles. And if you need to exhale, you can, contract your pelvic floor muscles if you want to know the difference, but really maintaining a state of deep breathing, inhaling and exhaling. But what's really important is upon the very beginning, as you are about to insert an object, so let's say you are going to insert a dilator, and by the way, my set of dilators, they do come with a handle, so you might get something similar to this where you insert it with a handle. Let me just put it in like that, so it just kind of helps you kind of hold it and grip onto it better. Okay, so if you are going to insert a dilator, for example, what's really important is that when you do position it, you experiment with the angle. You might need to raise it slightly or lower it slightly. As you are inserting the dilator, it's really important to take a deep breath in as you relax your pelvic floor muscles. Okay, and it's important to slowly insert the object into your vagina, and once you get it in, keep it in for a few minutes or even a bit longer than a few minutes. It could be up to like half an hour. Some women keep it in for like an hour. You don't need to do that. It could be for a few minutes. It could be for 15 or 20 minutes. Do what feels comfortable for you and what you would like to do. But what's really important is when you do take the dilator out, is again, you make sure that your pelvic floor muscles are relaxed as you take out the dilator and that you're taking a deep breath in as you pull the dilator out. Now, this is what's known as practicing insertion exercises. So inserting any object that you are comfortable with. Like I said, it could be a Q-tip or a cotton bud like this. You might want to get one with a slightly longer handle if you're able to get that. It could be inserting your own small finger or some of your fingers, as long as you kind of trimmed your nails and that your hands are clean. It could be inserting a tampon. It could be inserting the different sizes of dilators and progressively working your way through the different sizes. What's really important to know is that for the larger sizes of dilators, it's not always necessary to insert it the whole way. Okay, so if I show you the larger dilator, when you're inserting one of the larger dilators, it's okay if you get to about halfway or 3/4 of the way. It's not necessary for the whole thing to go in, especially because typically when a woman is practicing with dilators, she's usually using dilators or inserting an object into her vagina when she's not aroused. Some women like to do it when they're aroused, but most women, I believe, are doing it in a state where they're not aroused. And so if you're not aroused, it kind of causes your vagina to be in its kind of normal state where it's slightly shorter and slightly narrower. Whereas when you are aroused and you spend time in foreplay and you're about to have penetrative sex with your husband, your vagina naturally becomes longer and wider. So that's why I'm saying when you're practicing with the larger size dilators, it's not necessary to try and get the whole thing in, because as long as you're able to get roughly half to 3/4 of the way, that's perfect. Okay. Now, it's really important that when you are practicing these insertion exercises, that you commit to doing so on a regular basis in order for you to succeed. So typically I recommend a minimum of 4 times per week where you practice these insertion exercises. Some women like to do it every single day. So you could block out, let's say, a half an hour period each day at a time when you are relaxed and can be free from distractions. So if you are able to do it every day, that's great, to kind of build that consistency and that momentum. But if you're not able to do it every day, try and commit to at least try and commit to doing the dilation and the insertion exercises for a period of 4 times per week. Another thing I want to mention is it's not always necessary to use all the sizes of dilators. If you're really struggling with one of the larger sizes, but you're able to get, the first 2 or 3 sizes in, and you're just struggling with the last 1 or 2 sizes in your set, you don't necessarily always need to use the larger sizes in order to transition to intercourse, because the process of intercourse is a lot easier if you're spending time if you're aroused. That really helps and works in your favor. And also if you're spending plenty of time in foreplay, it's going to elongate your vagina, it's going to widen your vagina, it's going to cause you to become naturally lubricated, and also you will continue to use lubricant of your choice when you do progress to penetrative sex with your husband. Now, the final step is, after you've practiced these insertion exercises for a number of weeks, go at your own pace, at a pace that you're comfortable with. After you've practiced these insertion exercises, the next step is to transition to intercourse with your husband in a gradual way, where you don't put too much pressure on yourself to try and insert your husband's penis fully in one go. You can do it gradually and set yourself mini goals, so that the first time you attempt intercourse with your husband, it could be as simple as being comfortable with his penis touching your vagina. The next time you attempt intercourse, it could be that you've set yourself a mini goal where you want to insert the head of the penis. The next time could be like maybe trying to get a quarter of the penis, and so on, and then half, and then 3/4, until you eventually manage to get most of your husband's penis into your vagina. And again, even with the penis, it's not necessary for the whole penis to go in. If you're able to get roughly half to 3/4 of the way, that is fine. So only transition to intercourse when you feel comfortable with doing the insertion exercises on your own first. Some women ask me, is it necessary to do insertion exercises to have penetrative sex or pain-free penetrative sex? The answer is no, it's not necessary, but it does really help. It works in your favor. It helps to empower you and make you feel more confident, because you got to practice first on your own before doing the kind of real thing with your husband. But having said that, it's not necessary, because as long as you know how to relax your pelvic floor muscles and you use lubricant, especially the first few times you're attempting penetrative sex, you use lubricant, you make sure that you're feeling aroused and sexually turned on, you're spending plenty of time in foreplay, and you then attempt intercourse, having not done any insertion exercises, it is possible to have pain-free sex that way. But the key is to make sure your pelvic floor muscles are relaxed. And some women are not sure if their pelvic floor muscles are relaxed. And so that's why doing the insertion exercises with the dilators or Q-tip or fingers or tampons, whatever object you choose, that's why it's really important to practice the insertion exercises, so that you can prove to yourself that you know what you're doing with your pelvic floor muscles, you know how to get them to be relaxed. So that's it. Those are all the treatment steps to help you with overcoming vaginismus and experiencing pain-free sex with your husband. I'd love it if you could comment below. Let me know if you have any fears with completing any of the steps that I shared with you. What fears do you have about any of the steps that I shared? Let me know in the comments below. Now, if you are struggling with painful sex right now, if you know that you have vaginismus, or if you feel like you have a fear of sex, or if you're struggling with painful sex and you've ruled out any physical abnormalities or medical conditions, I'd love it if you could sign up for my free training. It's called Fearless Painless First Time Sex. It's an online training. It's about 90 minutes long. And if you'd like to register for this free training, the link is in the description box below. So that's the end of this video. I hope you found it beneficial. I'd love it if you could check out this video here, which talks about my own personal struggle to overcome vaginismus. Looking forward to seeing you in the next video. Take care.